Among the complications that usually occur in elderly people with diabetes is what is known as diabetic foot, which occurs as lesions of varying degrees in the lower limbs, as a result of poor blood flow or no nerve involvement as diabetic neuropathy. Diabetic neuropathy, also called distal symmetric polyneuropathy, is behind 85% of cases of diabetic foot ulcers, as shown in the following infographic, and produces a loss of sensitivity and proprioception in the affected limbs. Why is the diabetic foot developing? There are a number of risk factors that may favor the development of this condition, among which are age, years since the patient was diagnosed, history of kidney complications, smoking and poor glycemic control, among other issues. These risk factors are joined by a series of triggers, both extrinsic and intrinsic to the patient, which are determinants in the development of the diabetic foot, such as inadequate footwear, trauma or the action of aggressive chemical agents. In cases of elderly people with reduced mobility, so-called pressure ulcers may occur, areas of injured skin, usually on the feet, which in some cases lead to serious infections. Although these ulcers can be treated, people with diabetic foot are facing greater difficulty due to the risk of infection and the difficulty in wound healing, which may ultimately require limb amputation. Prevention. Therefore, to prevent the development of diabetic foot and its consequences, it is necessary that people with diabetes take a series of preventive measures. Keep diabetes under control. Patients should monitor their blood glucose levels regularly and avoid peaks of hyperglycemia and hypoglycemia. In this sense, it is necessary to combine a correct adherence to the treatment prescribed by the medical professionals, along with healthy habits in terms of food and the practice of physical activity. Review and monitor possible signs of risk. Since loss of sensitivity to pain is common when there is nerve involvement in the extremities, it is important to regularly check the feet and carefully monitor the skin if any type of redness or inflammation is detected. Respect hygiene and hydration guidelines. In this sense, from the Spanish Federation of Diabetes, feet, it is recommended to wash the feet every day with warm water and using products that respect the skin. The hydration should be centered on the back, the plant and the heel, avoiding the space between the fingers. Choose the footwear with attention. Comfortable footwear should be used, which allows the foot to transpire and adapt to it, avoiding chafing. It is appropriate to always wear socks made of fabrics such as cotton. Apart from these preventive advice, it is advised that people with diabetes perform a regular visit to their reference doctor, who will be the professional in charge of monitoring the good condition of the lower joints and carrying out diagnostic tests when considered necessary. Treatment. In the event that these tests determine the existence of diabetic foot, treatment will be scheduled to achieve a prognosis as favorable as possible, depending on the severity of the condition. In the presence of lesions in the form of ulcers, it is important to follow the guidelines of health professionals rigorously, since infections can be very difficult to cure and can lead to amputation of the limb. Depending on the degree of severity of the lesion, which is established between 0 and 5, and its pathogenesis, neuropathic, angiopathic or PD-charcot, therapeutic products will be prescribed for the treatment of the ulcer, which should be accompanied by good hygiene in the area and strict control of blood glucose levels. Investigations in progress. Currently, research is being carried out in different lines to improve the treatment and prognosis of diabetic foot since, according to the studies of the Spanish Society of Internal Medicine, at present, Spain is the second country in the world, behind the United States, with more lower limb amputations due to type 2 diabetes. Among the many lines of research that currently exist for the treatment of diabetic foot, include those of some researchers who are working with stem cells that could correct the neuropathic and vascular defect that leads to the amputation of many patients. An example of this is the research carried out in the Andalusian Center for Molecular Biology and Regenerative Medicine, CEPMR, led by Dr. Bernat Soria, where some types of stem cells that can stop the progression of the diabetic foot and that, in the latest clinical trials carried out, have shown a very high level of success. The Spanish Diabetes Federation, FED, is working to inform people with diabetes about the importance of knowing and preventing complications such as diabetic foot that, if not detected and treated in time, can impair their quality of life. Therefore, it is necessary that people with diabetes inform themselves and educate about their pathology, through resources such as those provided by some information portals on the internet or the patient associations themselves, and take measures to achieve good control of their diabetes.